Obesity and overweight, what it is, causes, diagnosis, treatment and more. Hello everyone, welcome back to MyBetterMe channel. Before we dive into what you must know about obesity and overweight, what it is, causes, diagnosis, treatment and more. If you are interested in losing weight or improving your overall health, which I know you are, make sure you like and subscribe to our channel to get more awesome and helpful weight loss and overall health videos like this one. Alright, let's dive right into it. Let's quickly talk about the key facts about obesity. Key facts. Worldwide obesity has nearly tripled since 1975. In 2016, more than 1.9 billion adults, 18 years and older, were overweight. Of these, over 650 million were obese. 39% of adults aged 18 years and over were overweight in 2016, and 13% were obese. Most of the world's population live in countries where overweight and obesity kills more people than underweight. 38 million children under the age of 5 were overweight or obese in 2019. Over 340 million children and adolescents aged 5 to 19 were overweight or obese in 2016. Obesity is preventable. Overview. Obesity is a complex disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern. It is a medical problem that increases your risk of other diseases and health problems, such as heart disease, diabetes, high blood pressure and certain cancers. There are many reasons why some people have difficulty avoiding obesity. Usually, obesity results from a combination of inherited factors, combined with the environment and personal diet and exercise choices. The good news is that even modest weight loss can improve or prevent the health problems associated with obesity. Dietary changes, increased physical activity and behavior changes can help you lose weight. Prescription medications and weight loss procedures are additional options for treating obesity. What are obesity and overweight? Overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. Body mass index, BMI, is a simple index of weight for height that is commonly used to classify overweight and obesity in adults. It is defined as a person's weight in kilograms divided by the square of his height in meters, kilogram per square meter. Adults. For adults, World Health Organization defines overweight and obesity as follows. Overweight is a BMI greater than or equal to 25, and obesity is a BMI greater than or equal to 30. BMI provides the most useful population-level measure of overweight and obesity as it is the same for both sexes and for all ages of adults. However, it should be considered a rough guide because it may not correspond to the same degree of fatness in different individuals. For children, age needs to be considered when defining overweight and obesity. Children under 5 years of age. For children under 5 years of age, overweight is weight for height greater than 2 standard deviations above World Health Organization Child Growth Standards median. And obesity is weight for height greater than 3 standard deviations above the World Health Organization Child Growth Standards median. Children aged between 5 to 19 years. Overweight and obesity are defined as follows. For children aged between 5 to 19 years, overweight is BMI for age greater than 1 standard deviation above the World Health Organization growth reference median, and obesity is greater than 2 standard deviations above the World Health Organization growth reference median. Facts about overweight and obesity. Some recent WHO global estimates follow. In 2016, more than 1.9 billion adults aged 18 years and older were overweight. Of these, over 650 million adults were obese. In 2016, 39% of adults aged 18 years and over, 39% of men and 40% of women, were overweight. Overall, about 13% of the world's adult population, 11% of men and 15% of women, were obese in 2016. The worldwide prevalence of obesity nearly tripled between 1975 and 2016. In 2019, an estimated 38.2 million children under the age of 5 years were overweight or obese. Once considered a high-income country problem, overweight and obesity are now on the rise in low- and middle-income countries, particularly in urban settings. In Africa, the number of overweight children under 5 has increased by nearly 24% since 2000. Almost half of the children under 5 who were overweight or obese in 2019 lived in Asia. Over 340 million children and adolescents aged 5 to 19 were overweight or obese in 2016. The prevalence of overweight and obesity among children and adolescents aged 5 to 19 has risen dramatically from just 4% in 1975 to just over 18% in 2016. The rise has occurred similarly among both boys and girls. In 2016, 18% of girls and 19% of boys were overweight. While just under 1% of children and adolescents aged 5 to 19 were obese in 1975, more 124 million children and adolescents, 6% of girls and 8% of boys, were obese in 2016. Overweight and obesity are linked to more deaths worldwide than underweight. Globally, there are more people who are obese than underweight. This occurs in every region except parts of sub-Saharan Africa and Asia. What causes obesity and overweight? The fundamental cause of obesity and overweight is an energy imbalance between calories consumed and calories expended. Globally, there has been an increased intake of energy-dense foods that are high in fat and sugars, and an increase in physical inactivity due to the increasingly sedentary nature of many forms of work, changing modes of transportation, and increasing urbanization. Changes in dietary and physical activity patterns are often the result of environmental and societal changes associated with development and lack of supportive policies in sectors such as health, agriculture, transport, urban planning, environment, food processing, distribution, marketing, and education. Although there are genetic, behavioral, metabolic and hormonal influences on body weight, obesity occurs when you take in more calories than you burn through exercise and normal daily activities. Your body stores these excess calories as fat. Most Americans' diets are too high in calories, often from fast food and high-calorie beverages. People with obesity might eat more calories before feeling full, feel hungry sooner, or eat more due to stress or anxiety. Risk factors. Obesity usually results from a combination of causes and contributing factors, family inheritance and influences. The genes you inherit from your parents may affect the amount of body fat you store, and where that fat is distributed. Genetics may also play a role in how efficiently your body converts food into energy, how your body regulates your appetite and how your body burns calories during exercise. Obesity tends to run in families. That's not just because of the genes they share. Family members also tend to share similar eating and activity habits. Lifestyle choices. Unhealthy diet. A diet that's high in calories, lacking in fruits and vegetables, full of fast food, and laden with high-calorie beverages and oversized portions contributes to weight gain. Liquid calories. People can drink many calories without feeling full, especially calories from alcohol. Other high-calorie beverages, such as sugared soft drinks, can contribute to significant weight gain. Inactivity. If you have a sedentary lifestyle, you can easily take in more calories every day than you burn through exercise and routine daily activities. Looking at computer, tablet and phone screens is a sedentary activity. The number of hours you spend in front of a screen is highly associated with weight gain. Certain diseases and medications. In some people, obesity can be traced to a medical cause, such as Prader-Willi syndrome, Cushing syndrome and other conditions. Medical problems, such as arthritis, also can lead to decreased activity, which may result in weight gain. Some medications can lead to weight gain if you don't compensate through diet or activity. These medications include some antidepressants, anti-seizure medications, diabetes medications, antipsychotic medications, steroids and beta blockers. Social and economic issues. Social and economic factors are linked to obesity. Avoiding obesity is difficult if you don't have safe areas to walk or exercise. Similarly, you may not have been taught healthy ways of cooking, or you may not have access to healthier foods. In addition, the people you spend time with may influence your weight. You're more likely to develop obesity if you have friends or relatives with obesity. Age. Obesity can occur at any age, even in young children. But as you age, hormonal changes and a less active lifestyle increase your risk of obesity. In addition, the amount of muscle in your body tends to decrease with age. Generally, lower muscle mass leads to a decrease in metabolism. These changes also reduce calorie needs, and can make it harder to keep off excess weight. If you don't consciously control what you eat and become more physically active as you age, you'll likely gain weight. Other factors. Pregnancy. Weight gain is common during pregnancy. Some women find this weight difficult to lose after the baby is born. This weight gain may contribute to the development of obesity in women. Breastfeeding may be the best option to lose the weight gained during pregnancy. Quitting smoking. Quitting smoking is often associated with weight gain. And for some, it can lead to enough weight gain to qualify as obesity. Often, this happens as people use food to cope with smoking withdrawal. In the long run, however, quitting smoking is still a greater benefit to your health than is continuing to smoke. Your doctor can help you prevent weight gain after quitting smoking. Lack of sleep. Not getting enough sleep or getting too much sleep can cause changes in hormones that increase your appetite. You may also crave foods high in calories and carbohydrates, which can contribute to weight gain. Stress. Many external factors that affect your mood and well-being may contribute to obesity. People often seek more high-calorie food when experiencing stressful situations. Microbiome. Your gut bacteria are affected by what you eat and may contribute to weight gain or difficulty losing weight. Previous attempts to lose weight. Previous attempts of weight loss followed by rapid weight regain may contribute to further weight gain. This phenomenon, sometimes called yo-yo dieting, can slow your metabolism. Even if you have one or more of these risk factors, it doesn't mean that you're destined to develop obesity. You can counteract most risk factors through diet, physical activity and exercise, and behavior changes. Complications. What are common health consequences of overweight and obesity? People with obesity are more likely to develop a number of potentially serious health problems, including heart disease and strokes. Obesity makes you more likely to have high blood pressure and abnormal cholesterol levels, which are risk factors for heart disease and strokes. Type 2 diabetes. Obesity can affect the way your body uses insulin to control blood sugar levels. This raises your risk of insulin resistance and diabetes. Certain cancers. Obesity may increase your risk of cancer of the uterus, cervix, endometrium, ovary, breast, colon, rectum, esophagus, liver, gallbladder, pancreas, kidney and prostate. Digestive problems. Obesity increases the likelihood that you'll develop heartburn, gallbladder disease and liver problems. Gynecological and sexual problems. Obesity may cause infertility and irregular periods in women. Obesity also can cause erectile dysfunction in men. Sleep apnea. People with obesity are more likely to have sleep apnea, a potentially serious disorder in which breathing repeatedly stops and starts during sleep. Osteoarthritis. Obesity increases the stress placed on weight-bearing joints, in addition to promoting inflammation within the body. These factors may lead to complications such as osteoarthritis. Quality of life. Obesity can diminish your overall quality of life. You may not be able to do things you used to do, such as participating in enjoyable activities. You may avoid public places. People with obesity may even encounter discrimination. Other weight-related issues that may affect your quality of life include depression, disability, sexual problems, shame and guilt, social isolation, lower work achievement. Facing a double burden of malnutrition. Many low and middle-income countries are now facing a double burden of malnutrition. While these countries continue to deal with the problems of infectious diseases and undernutrition, they are also experiencing a rapid upsurge in non-communicable disease risk factors such as obesity and overweight, particularly in urban settings. It is not uncommon to find undernutrition and obesity coexisting within the same country, the same community and the same household. Children in low and middle-income countries are more vulnerable to inadequate prenatal, infant, and young child nutrition. At the same time, these children are exposed to high fat, high sugar, high salt, energy-dense, and micronutrient-poor foods, which tend to be lower in cost but also lower in nutrient quality. These dietary patterns, in conjunction with lower levels of physical activity, result in sharp increases in childhood obesity while undernutrition issues remain unsolved. How can overweight and obesity be reduced or prevented? Overweight and obesity, as well as their related non-communicable diseases, are largely preventable. Supportive environments and communities are fundamental in shaping people's choices, by making the choice of healthier foods and regular physical activity the easiest choice, the choice that is the most accessible, available and affordable, and therefore preventing overweight and obesity. Whether you're at risk of obesity, currently overweight or at a healthy weight, you can take steps to prevent unhealthy weight gain and related health problems. Not surprisingly, the steps to prevent weight gain are the same as the steps to lose weight: daily exercise, a healthy diet, and a long-term commitment to watch what you eat and drink. Exercise regularly. You need to get 150 to 300 minutes of moderate intensity activity a week to prevent weight gain. Moderately intense physical activities include fast walking and swimming. Follow a healthy eating plan. Focus on low-calorie, nutrient-dense foods, such as fruits, vegetables and whole grains. Avoid saturated fat and limit sweets and alcohol. Eat 3 regular meals a day with limited snacking. You can still enjoy small amounts of high-fat, high-calorie foods as an infrequent treat. Just be sure to choose foods that promote a healthy weight and good health most of the time. Know and avoid the food traps that cause you to eat. Identify situations that trigger out-of-control eating. Try keeping a journal and write down what you eat, how much you eat, when you eat, how you're feeling and how hungry you are. After a while, you should see patterns emerge. You can plan ahead and develop strategies for handling these types of situations and stay in control of your eating behaviors. Monitor your weight regularly. People who weigh themselves at least once a week are more successful in keeping off excess pounds. Monitoring your weight can tell you whether your efforts are working and can help you detect small weight gains before they become big problems. Be consistent. Sticking to your healthy weight plan during the week, on the weekends, and amidst vacation and holidays as much as possible increases your chances of long-term success. Individual responsibility can only have its full effect where people have access to a healthy lifestyle. Therefore, at the societal level it is important to support individuals in following the recommendations above, through sustained implementation of evidence-based and population-based policies that make regular physical activity and healthier dietary choices available, affordable and easily accessible to everyone, particularly to the poorest individuals. An example of such a policy is a tax on sugar-sweetened beverages. The food industry can play a significant role in promoting healthy diets by reducing the fat, sugar and salt content of processed foods, ensuring that healthy and nutritious choices are available and affordable to all consumers, restricting marketing of foods high in sugars, salt and fats, especially those foods aimed at children and teenagers, and ensuring the availability of healthy food choices and supporting regular physical activity practice in the workplace. Check the description below for our recommendation on the most effective way to prevent obesity and overweight, and take action now to see the best results. If you have any questions at all, please feel free to ask us in the comment section below and we'll respond to you as fast as possible. And also, we'd like to know where exactly you are at your weight loss journey. It's always our pleasure to help. Thanks for watching. If you like the video, please share with your friends and click the like button. And subscribe to our channel if you haven't already done so, and turn on the notification bell icon so you will be notified about our new uploads. Thank you.